Hello, welcome to my channel.
Mom, no.
Yeah, today is an important day for my wife, and it's her poster day. What's poster day?
Poster day because like during this summer we did an 11-week practicum during the summer. So today we present what we've done at that time and share our experience with our first year students. Hi, this is our building, the Practicum Hall. This is where we present our poster.
The garden is so beautiful, so gorgeous. Hello, Yuki. What did you do in your practicum?
I work at BCCDC, so my project is related to the impact of COVID-19 on Hep C services. And what I did is to do a literature review and then try to find the impact of COVID-19 on Hep C services. So this is the result. The most impacted services in the HCV services is the anti-HCV testing and then the treatment. So we can see there is a lot of decrease during the pandemic, and especially the vulnerable population were affected more than the general population. And from the literature, we find out some barriers and then some mitigation strategies to help to facilitate the HCV services. So yeah, that's basically what I did during that 11 weeks.
Okay, how is your practicum?
Oh,
do you like it?
It is harder than I thought because this is the first time I work
the first time Canadian
Canada.
working experience.
Yes, first Canadian.
So stressful, right?
Yeah, very stressful. But I learn a lot from that, and I grow. And I think that's the most important
Finally,
part.
put it all. Okay, great. Hello.
Hi. What did you do in your practicum?
Yeah, so for my practicum, I work for a population and public health consulting firm. So they have a bunch of different projects that are related to health, education, and the environment. And so the project I worked on while I was there was basically adapting a pocket guide for humanitarian workers responding to gender-based violence and adopting it from a high literacy version to a low to no literacy version. So it involved getting community feedback about what images would be appropriate and going through sort of all that data and sorry, getting distracted. Yeah, that's what I did.
How do you feel about your practicum?
It was a really great experience. It really taught me a lot about working in public health and also just the different domains in health that there's work available. I didn't really know what the job market kind of would look like and what kind of work there is. And so yeah.
But you do your practicum in BC or?
Yeah, it's in Vancouver. So the firm is based in Vancouver. Some of the staff went to South Sudan to do some of this work, but I did
okay.
Yeah.
Yes.
Okay.
Thank you very much.
You're welcome.
Thank you.
Thank you. Wow, it's so beautiful.
Hi, this is Arjuna. Can you tell me something about your practicum?
So for the summer practicum, I did my practicum at Women's Health Research Institute. So our study focused on anal cancer study. So the anal cancer cases are increasing globally each year. And then our focus is to determine the need and the feasibility of anal cancer screening. Our target audience are BC women, and we also narrowed down to the women who are already having any HPV related cancers. So that's the aim of the study. So we started with the environmental scan. So where we started with the literature review, survey development, we also found categorize and then identify the stakeholders, and then I kind of made an infographics. So this is the infographics which I prepared for my interview, and these are the people. These are my WHRA people. So yeah. is my project.
How do you like your project?
It's really like insightful for me because this is my first work experience in Canada. So I really loved it and I gained like a lot of experience about how to manage time and then the workplace culture and everything. So it's a really nice experience for me.
Okay, great.
Thank you very much. Thank you. Hi, Simon. Tell me something about your practicum.
The weird thing was that I went as uncomfortable as I could go. So I have no background in mental health, I have no background in animal therapy, and so I picked something I'd never touched before. So our study was all about patients going through addiction and relapse and how animal therapy could help them go through their withdrawal. So it was a lot of fun, very uncomfortable, but it was a lot of fun. I really enjoyed
It's a
it.
challenge.
Yeah, definitely.
Okay, how do you feel about that? Or can you tell us some challenge you encountered during your practicum?
Definitely. I think it's more so like the hands-on experience too, because like we worked at the hospital, and so being able to actually meet patients directly who are going through addictions work, like I think a lot of the time when you're doing research, it's sort of like from afar. You're not really like interacting with people, you're just going through data or reports. Whereas in this case, like we were interviewing people on like a weekly basis, talking to them in hospital beds, and seeing how like addictions affected people directly, especially in psychiatry and withdrawal from like opioids, alcohol. It was very like emotional. It was very difficult to see, but it made it very real to realize like this is a big issue that people are dealing with, and actually getting to see it from like a clinical primary hands-on perspective was like a very humbling experience to actually do. It was really cool. So, yeah. It was a lot of experience. It was a lot of stuff. It was a lot, but I had an amazing time. It was so cool.
Yeah, great.
Thank you very much.
Awesome, guys. Love it. I'm sure it'll turn out great.
On in their program. Before we know it, we'll be on the complication stage. Walking away with degrees.
Hi, Beth. Can you tell me something about your practicum?
Yeah, so my practicum was about perinatal mental health. So I did a project about postpartum screening for anxiety, because here in Canada and a lot of countries, there's no screening strategies for anxiety postpartum. So that was the main thing I did. I worked with another practicum student named Tanya, and I also did something called C-Care, which is a C-section postpartum care app, like a mobile application. So just tracking, and that's what this is about, so tracking like pain and other factors like influencing health after birth.
So, do you have any findings during your practicum, or just helping develop the?
I was really just helping them develop. So I did 2 protocols. So those studies I did the protocol for. I did some literature review about risk factors and different things. And then helping make a perinatal resource list for mental health for some groups that were not identified, like LGBTQ.
So, like, which part was the most challenging part during your practicum?
The most challenging part was that my preceptor was in another country when I started my practicum, so like communicating, getting and I was also fully remote, so that was also hard to get to know this team.
Yeah,
so
I encountered the same problem.
Yeah.
Okay, so thank you very much.
You're welcome.
Yeah, thank you.
This is a video. Everybody say hello. Day, my feet hurt and I lost my voice because I talked to so many people, and yeah, it's happy that my practicum ends and then we go through everything, and I learned a lot and gain a lot of experience from this practicum. So yeah, that's how a practicum looks like, and what we did during our practicum. I hope this information are useful to anyone that is interested in our program. Yeah, see you.
Sunny，你觉得那时候妈妈在实习的时候辛不辛苦？
很辛苦。
妈妈有没有时间陪你？那都是谁陪你？
你。